I would like to thank Lightman Corporation, Jennifer, for inviting me. And I will just tell about my real experience with this laser. I own it from now is 5 years. And what we think when I had to describe this laser is a Swiss knife. This is the title that we decided with Jennifer, just because I want to show how you can use this laser for a lot of things in your office. So it makes it really cost effective. So I'm Miguel Rechichi, I present me. I come from Italy. Ophthalmology is my second job. I do a lot of things before. I'm very interested in sport, and I'm addicted in technology. And this is one of the reasons why my career was all, my effort was all due to develop laser in ophthalmology. My interest is also cross-linking. I developed the Avidro technology, and I'm really a nerd, so I'm really interested in everything in technology that could improve my work. So, these my life choices. In the life, I choose my car, and I invest on Tesla 10 years ago, not only in the car, but also in the stock. Why I invest in this technology? Because, okay, I love car, but you can buy a SUV, but the SUV is very good when you go off-road, but when you go on the street, probably it's better a Ferrari. But if you buy a technology that can cover both, you will be for sure the best buy. And this is the reason why I like the TruScan Pro, because it's a very compact machine and really expand all my retinal treatments in my clinic. I'm a private, so I invest on myself. And when I choose a new technology, I have to choose something that really fit all the things. I cannot buy one laser for one pathology. So I prefer always to think at a technology that cover most of the retinal disease. And for this, the TruScan is unbeatable for cost effectiveness. And now it opened my mind also for the new clinical application. I don't want to bother you about the yellow laser technology. I want just to say that yellow wavelength really is very useful because it really harms less the retina, especially the photoreceptor, respect to the green laser. This is the reason why actually the yellow laser is the best in class for retinal photocoagulation. And this is the reason why all the SP-Mode technology is developed with the yellow laser, because it harms less the photoreceptor, so you can titrate and use it direct on macula for a lot of macular disease. And the perfect couple is the pattern laser, because it adds efficiency, speed, and is very, very useful for both patient and for the ophthalmologist, because it can do the same work in seconds with respect to the one-spot laser. And with this laser, you can choose really a lot of shape. You can also customize this. You can save and put it on your finger. So in 1 second, you are ready to go. So let's talk about everyday activity for a retinal laser, photocoagulation. So if you have a pattern spot laser, the speed of your treatment dramatically increase. And the other good things is that the yellow laser is less painful for the patients. What I like really much for this laser is the micro joystick that allows you to move the pattern with your finger, And it's very useful, especially for a very peripheral lesion, because sometimes the patient is not so collaborative. So you put the patient straight and push with a finger the micro joystick, and you can reach the peripheral retina with a very, very easy way. And the mass of this laser is the SP mode. What is SP mode? Essentially is a titration of a full threshold laser. You can choose 5%, 10%, 15% of duty cycle, but this was revolutionary because for the first time we can use laser also on fovea. And honestly, first time that I did the first treatment on fovea, I chose a patient with a fibrovascular membrane because I was very feared about to spot laser directly on fovea. But then, by the time, I rapidly believed that this could be really a game changer, especially for a pathology like central serous chorioretinopathy. And actually, I use a 5% titration, so 5% duty cycle. And the reason why it's not harmful for the photoreceptor is because with this titration, you do not rise the temperature, so you do not have a burning effect, and this is very safe for the fovea. But I will show you in a real world how you can use also this technology to speed up the reabsorption of fluid from retina, because there's a lot of publications who show that this technology speed up the reabsorption of fluid because it stimulates the RPE cells. Look at this. This is a patient with a bullous inferior retinal detachment in which I did a surgery. And I want to show you this. This is immediately post-operative. The hole was closed. I will show you the surgical video. But there was a lot of fluid in the inferior part. So I did the surgery. And in these cases, I prefer, it was young, it was an inferior hole. So I prefer a more conservative treatment. So the retinal buckling. And as you can see, I drained the fluid, and then I check. And my surgery was good, but the problem was that after 15 days, I cannot see a complete reabsorption of fluid. And I was sure that the surgery was good and the hole was closed, but there was still a lot of fluid. And this is the reason why I try and use this technology to speed up the fluid absorption. And in this way, I stimulate the RPE, and after just a few days, after a month, there was a complete reabsorption. In this case, you can use a grid. I use this pattern just on the inferior retina, and you can see immediately a speed up in the reabsorption of fluid. And after 1 month and a half, the situation was this: the retina is completely reattached, and there is no one drop of fluid. This is another cases. This is the most common cases for which you can use both retinal photocoagulation and the titration technology, SP-Mode. In this case, you have a classic central serous retina chorioretinopathy. And in this way, I usually do this. I do the angiography in which I can find the point of leakage, and I use both a single spot retinal photocoagulation on the leakage point, and then the SP-Mode. So this is the plan, focal laser on leaking area, and then the SP-Mode Microsecond Laser on the large area, central area, to speed up the reabsorption of fluid. And I treat all the cases like this. This is pre-op, and after 20 days, we have a consistent reabsorption of fluid, and then in 2 months, the fluid is gone. So this is the reason why I call it the Swiss knife, because you can use the same laser in different way to treat each aspect of each pathology. And this is in another cases. This is a drusenoid detachment after resolution of a neovascularization, and it was a patient who was treated with anti-VEGF, and there is still some fluid under the RPE detachment. And I tried to find with the fluorangiography if there was some leakage, and I have this little point of leakage there. And then my choice was to use the SP-Mode to boost the activity of RPE, and you can use it safely in the macula because it will not hurt the photoreceptor. And then I observed after a month a marked reduction of metamorphopsia because also the drusenoid material start to reabsorb. And this is another possible application of SP-Mode, the drusen for a dry MD. There is a lot of published data who show that stimulation of RPE in a drusen promotes the reabsorption. So it's another way to use the SP-Mode. This is another patient with a persistent Irving-Gass syndrome. This is a typical syndrome that you can have after cataract surgery, especially in high myope. And literature shows us that most of these cases are due to RPE decompensation. So why do not use SP-Mode for this patient? And this is exactly what I did. If you look at the OCT of this patient, this was a patient which I treated for a long time with the FENS, non-steroid drops. But the liquid was reabsorbing, but then after months, it was there again. So I made the diagnosis of RPE decompensation, and so I tried to use the SP-Mode. And after one shot, the patient now is stable from years. So look also at this technology for edema post-cataract surgery. What are my parameters? I use usually a 7x7 grid, 350 milliwatt with a duty cycle of 5%, so the 5% of 350 milliwatt. And I use a confluence spot, so I make usually at least 6 grid to cover the whole macular area. And as you can see, the result also in this case is a complete and stable resolution of the fluid. And this patient who was treated repeatedly with the anti-VEGF injection. So just with one retinal treatment, we solved the problem. This is another cases of persistent macular edema after occlusion, vein occlusion of the retina. Sometimes these patients receive tons of IVT injections. So you waste a lot of money. You have a lot of risk because each injection is a possibly factor for infection. So you have to think at this retinal micropulse technology, especially in this patient who are resistant to the IVT injection. So in these cases, I use SP-Mode in in the fashion which I described. So five grid of 7.7 with a duty cycle of 5%. And then after this, I have a complete resolution after years in which this patient was complaining about edema. And I'm concluding, but I want to show you that you can add some optional to your laser as in your car. And one of the optional that I found very useful is this mouse. This is a vertical mouse that LightMed could send to you. And the beauty of this is that you can change the pattern, you can change the power, and also the orientation of the pattern just without removing your eyes from the patient. So you can use simply your right hands and you can use the mouse to rotate. The mouse can rotate in one direction, in the other, and you can easily adjust your pattern without removing the eyes from your patient. It's very, very useful, it's very fast, and I think it's the good optional for your laser. And this is a future development. I was telling also with Jennifer about this. We are developing a simple 3D technology that you can add to your slit lamp, in this case is the laser. A simple technology in which you can use a 3D monitor that automatically switch from 3D to 2D mode because it's a movement sensor. So if you go very close, you will see in 3D without glasses. If you go far, you can see in 2D. And you can directly use the monitor to deliver the laser. In alternative, you can use 3D goggles, and for the first time, you can do 3D laser treatment, in which you can have also the perception of depth. Remember, the main problem of surgery is that when you work with a high magnification, you lose the perception of depth. The 3D technology for this is beautiful, and I also start to do the first 3D retinal laser. And the other beautiful things is that also the relatives or the doctors that assist you can see your treatment in 3D without glasses. So it's a great tool also for teaching, not only for the operator. And I will show you how can you easily from outside see the retinal treatment in 3D or 2D, and it is very useful, especially for teaching. So, by the way, my experience with the TruScan is now that I call it the Swiss knife in the hand of a skilled surgeon. SP-Mode technology extremely widen your retinal disease application, and yellow laser fit 90% of common retinal disease. And honestly, in my hand is really, the TruScan Pro is an incredible tool for treating retinal pathologies, and honestly is also the best in class in terms of cost effectiveness. And remember, as this Turkish guy remember us, the state-of-the-art technology is not the most complex, but the more effective. And you remember this Turkish guy who was a shooter and wins a medal with a minimal gear, and the other competitor has a lot of technology. So technology is good, but also you need the skill, and sometimes not the most complex technology is the best. So because our skills and our skill remain always the best technology. And thank you. And I want just to add another things that for LightMed company, that is one of the few company in which you can do development directly with the CEO. So we have not filtered I'm also very happy because each idea I can share directly with the team, directly with the Jennifer Lee, and this is a very good things that you cannot find in really in a big company like this. So thank you.